In the BBC podcast, you said we didn't take the right precautions to make sure that older people leaving hospital, going into care homes, were as safe as they could be, and that was a mistake. Is that something that you stand by?
It was a mistake in the presumption that all our care homes understood infection prevention and control and were practicing it.
Sorry, forgive me. You said that you didn't take the right precautions.
That's right, because I presumed that all our care homes were adhering to the national manual.
So that wasn't referring to other things that you could have done, like PPE provision? At
that stage, no, but we very quickly did introduce PPE provision. But at that early stage, we were not aware that there was a consistent problem across the sector on securing adequate PPE.
If I may,
again,
sorry.
Yes. When you told the podcast we didn't take the right precautions, appreciate that you say that you didn't because it was based on a presumption, but what precautions could you have taken?
So I think we could have introduced earlier if I had not made that presumption. We could have introduced earlier the wraparound support that we did from directors of public health and nurse directors in each individual board to provide greater clinical support to the care home sector.
Thank you.
And before we end this topic, can I just quote to you two accounts from Every Story Matters. Mm-hmm. The first is from a social worker in Scotland who says, at the beginning, people were discharged into care homes without any testing in place, and also at times without any real assessment to determine the views and wishes of the older people involved. I found this a huge compromise of my ethical values. It was clear that hospitals were becoming overwhelmed. And then another by a loved one of a care home resident in Scotland. Two people that were discharged from hospital back into care homes having tested negative. 2 days later turned out that they had COVID. It was like my worst fears had been realised. I just kept waiting for the call to say she had COVID. I couldn't sleep. I couldn't eat. It was torture. Ms. Freeman, looking back, do you have any reflections about the decisions that you made in relation to the discharge policy? And do you think that you could or should have taken a more cautious approach?
In the circumstances at the time, with the resources I faced and the understanding that we had of the virus and how it transmitted, I don't believe I could have taken a different decision from the one I took. I have always said that if I had the capacity at the time to test before discharge, I would have done so and did so as soon as that capacity was available, but we did not have it. And so, and as I've also said, but I think it bears repeating, that we were not making binary decisions between a risk-free option and a risk option. We were making decisions between relative degrees of risk.